Good afternoon, everybody, and thank you very much for turning up and listening to what we have to say today. I'm going to try and give myself a challenge, which is I have 9 slides for you. I'm going to try not to use exercise once. Now, the reason for that is quite purposeful, because we're really interested in active lifestyles, and an active lifestyle is moving around the room. It's going from one place to the next, and it's really important for us to understand the science behind that. And we've been very fortunate to be supported by a number of different charities and organisations in the work that we do. I'm going to give you a flavour and an overview of the focus that we have, and then a range of people from different groups are going to talk more specifically, so that hopefully in just under the hour that we have, we can fill your minds with some more information. But more importantly, I hope you'll raise more questions, either ask them as the group, or come along and have a conversation with us, because we're all going to be around for the next few hours. So my training is in clinical science, and I've been really fascinated in a range of different things. And this is an example of what's called a wicked problem. Now, wicked isn't me getting down with the kids and being cool. It's the fact that our lives are quite complicated problems, and that things that you do in different parts of your life interact. So, for example, on the top, your postcode, for most people, will predict your BMI. And underneath that, we've got all these different interrelated complex things happening inside the body. And then even lower down, we've got even more complex things going on with DNA, with RNA, and things that are going on. But the thing that really fascinated me was just how complex all these different interactions are, but also how simple they are. So, for example, the social networking side of things, we know that the friends that you have influence the types of behaviour you have. Whereabouts you live, whether you live in a sunny part of the world or you live in Newcastle, influences your ability to go outside. Your postcode determines how safe the environment is around you. So we're starting to understand that talking about an active lifestyle or an inactive lifestyle is far more than talking about the E word. We're also starting to understand that these things are interrelated. And so as we start to look at movement patterns, that not moving has an impact on the heart, it has an impact on the muscles and on the lungs. And we're starting to understand how we can try and provide better information about helping people to move as a way to manage and make your heart work better, to make your lungs work better, as well as making your muscles work better. And down on the bottom of this is where the really fantastic science that we're able to do comes from. Because one of the concerns for us has always been making sure that what we do is safe. And what we're able to do now is better understand what's going on at a very fine level to make sure it's safe, so that at the highest level we can socialise, we can go away and do all the different things that we want to do with an active lifestyle. And in one schematic, this is an overview of what we're trying to do. And this is an example with people with mitochondrial disease. So on the left-hand side on the bottom are people with worse mitochondrial disease. And on the right-hand side are people with better mitochondrial disease. And on the left-hand side, you can see how active somebody is. And generally, the worse somebody's mitochondria are, the less active they are. Now, this is because moving becomes more and more difficult. And our challenge is, can we use a physical activity as a way to help people with worse mitochondria, help them become more active as a way to improve the way that the mitochondria are working? It looks good in a slide, doesn't it? Really nice and easy. The reality is far more complicated, of course. And one of the pieces of work that Dr. Gorman led was having a look at this in real life. So it's great to see so many familiar faces around the room, and quite a lot of you will have taken part in this. So we had a look at activity patterns of people in the clinic, and we had a look at, across the bottom, the presentations that people came through with. So the more to the right it is, the worse people were. On the left, the more active they were, the higher they were up. You can see that it's a nice curve on the last slide, but on this one it's a lot more noisy. And in particular, I'd like to highlight these two people. So they have very similar clinical presentations. So their disease is as bad as each other, but you can see they have very, very different physical activity patterns. So one of the individuals is doing nearly 14,000 steps per day, but this person is doing next to nothing. So our challenge is to better understand why these things are happening and how to help people become more active as a way to maintain muscle function, but also to improve quality of life. And this is particularly of interest because the level for the general population of activity which is good for health is about 10,000 steps. So 80% of the group that are coming into clinic are not as active as the government should suggest we would be. And if we have a look at age and BMI matched people without neuromuscular disease, there's even fewer. So helping people become more active is become a core part of the science that we're trying to understand. And another part of this is physical fitness. Now, physical fitness doesn't mean how fast you can run a 400-meter time. It means your ability to do different things. And we measure physical fitness because it shows how well the heart's working and the lungs are working and the muscles. Now, this is what happens over your lifespan. So if any of you are planning on being an Olympic athlete, the first thing you should do is check your date of birth. Because in your mid-30s are when you reach your peak level of fitness, and then it declines in all of us, and we don't know why. And what we're seeing in people with neuromuscular disease is that this curve is put to the left, and so that people's physical fitness is peaking earlier, but also there's a more rapid decline. So our challenge is to try and help people keep their level of fitness. And that for us is quite important, because at this point here is where your physical fitness level starts to mean that you can't do things in your everyday life that you would like to do, such as walking to the shops, getting out of bed, walking downstairs, walking upstairs. So the challenge is to better understand how we can help people be more active so that they can do the things that they want to do in their everyday lives. And I know that there's some of the world's best genetic people in the audience, but this is my understanding on genetics, is that we have healthy genes and poorly genes, and if you put them in a good environment, your chance of having problems with your brain, heart, muscles or lungs is quite low or medium. But if you have poorly genes, so genes that aren't working correctly and you don't put them in the right environment, your likelihood of having complications is actually quite high. And so what we're wanting to do is changing the genetic makeup of an individual at the moment is very, very difficult, but what we can do is better manage the environment. And that really is the focus that you're going to hear about today. And the work that we're doing is focusing on different parts of the body. So we're trying to understand principally what's going on with muscles. So if somebody does nothing, what happens to muscles? If somebody does something, what happens to muscles? Now, I've made it this far and I will use the E word here. So the only reason we're interested in exercise is it's quite a structured way to help people become more active. But it's not everything. For most individuals, just moving more and sitting less will have a powerful effect. Or for people in wheelchairs, being able to use your upper body muscles will have a powerful effect. But we're also interested in the flow-on effects of this on the heart and the brain, and also general physical function. And as we're collecting this information, we're able to provide more information back to you to explain what's going on with your body and what is safe and what might not be. And some of you might have taken part in some focus groups. Well, that's very much the focus of those. The second part is to be able to provide information back to the healthcare professionals. Because 10 years ago, we would have told people with neuromuscular disease, don't move, look after yourself. Now the message is coming round the other way, that we should be trying to move as a way to keep the muscles working. And the thing that's changed that has been our knowledge and our science. And through these, one of the views that we have moving forward is to pull this science together to be able to provide more information to you, the people around you, but also to clinical care teams. And our view is really to take that science and make it more widely available. So, neuromuscular disease is complicated. It's a wicked problem, and it has an effect on so many parts of your life. But the work that we're doing and that you're going to hear about today is really about understanding the direct effects on the body. And the view that we always have in mind is here, that we should be giving you the best advice and supporting you the best way that we can. And you're going to hear from some of the best people in the UK today about how to do that. Thank you very much, and I look forward to welcoming the next speaker.